well as view routed documents. Now, with the EHR program, depending if you are already using PracticeMate, which is the practice management service that we offer for billing, accounting, these programs are integrated together. So any patients that you have in PracticeMate would automatically populate in EHR. Now with EHR, you want to make sure that each staff member has their own username. So each person would have their own username. You could even set permissions as far as what that specific staff member has access to. But when they log in, they will see whatever you have enabled them. So with the desktop here, depending if that person is a provider or they have, maybe they're a nurse practitioner and you're scheduling appointments for them, they would actually be able to have this set to them and be able to see their appointments that they have set up for today. In this case, I have mine just defaulted to show all. With the messages, so I had mentioned this function is very similar to emailing, but it's all secure, HIPAA compliant. It's through the EHR program. So when you generate a new message, you'll be able to send to any staff member that is in the EHR system. You also actually will have an option to send to external contacts. So maybe you have a colleague that actually uses our EHR program, but they're not in your office. You would be able to add them into your account as a way to be able to send messages to them. So the coworkers button, this just pulls up your staff list, so all your staff members and the username that you would have created for them. Then just putting in the subject. So again, kind of like what you would do for an email. Now, depending on this message you're going to be generating, maybe this happens to be regarding a patient. If it is, you actually can attach a patient to this specific message. And then typing in whatever the message may be, and then clicking send. So whoever you would have selected to send this message to will now have that available on their desktop. So it does display here bold when it's a new message, tells you who it's from, when it was sent, and the patient. Now this patient's name is a hyperlink, so I can actually click on it and go right into their chart if I need to. I can view whatever the message was. I could then reply. If there was multiple people that this message was originally sent to, I could reply to everybody, or I could just forward this to someone else. I do also have an option of creating an encounter. So instead of having to maybe copy this message and go over to the patient's chart and paste it into a note, you can actually just create an encounter. It'll add whatever the message was as part of the chief complaint. So if you need to put additional information in here, you can, specifying what type of encounter that it is, and then also the provider. When you click update, this will now be saved as basically a progress note in that patient's chart. You'll also see the encounter ID here that you would be able to click on, and it takes you to that note. Under tasks, so this would be things you need to assign somebody to do. Maybe order a lab result, maybe do a prescription refill, maybe call a patient back. Really, whatever it may be, you would just choose to add new. Put in whatever the subject is. Description. If this is something that maybe needs to be done for a patient, you can attach a patient. You can set priority. You can assign a due date if you need to. And then choose who you want this assigned to. So a specific user will pull your staff list. Depending, maybe you want to assign it to anybody in the system that is a receptionist or anybody that's in the system as a nurse. So a role is basically a group of people. So this task would show up for anybody in the system that is considered a nurse practitioner or a nurse or provider, whichever one I would have selected. So when we update it, it's going to display the task. So at this point, it's going to sit here until I've changed the status. At that point, I would use my filters if I ever need to go and search for an old task. So to view it, you would just click the subject. So the subject will open it up, I can read whatever's in here, and then I can change the status. Maybe I'm working on it. Maybe I've completed it. So when I change the status and I click update, it's going to remove it from my list here, but I can always go back and I can look at it. Then whoever would have generated that task for me will now see that on their message section. So here there'll basically a comment telling me that this person I assigned the task to did complete it. The routed document section here is basically a way to have somebody look at a progress note or review a lab result, maybe sign off on a note if they didn't do that. It's almost like if you were to make a little Post-it note and put it on somebody's desk to have them check something out, you would actually just route that to their desktop. So it's a way for them to come in here and see when you sent it, who the staff member was that sent it, what it is. So if it's a progress note, a lab result, an x-ray, the patient that it's for, the reason why it was sent to me. I can see the status if I did sign off on it or if I didn't sign, and then I can view whatever that document is. So in this case, I have a lab result that was sent. At that point, I also do have an option of signing off. So maybe a nurse is going through and making sure the provider is signing off on notes and they forgot one. That nurse could route that document, or I should say encounter, to the provider, and the provider could just sign off here. And then you even have an option to remove documents from the routed section. So when you remove a document from the routed documents panel here, it doesn't delete it from the program. It's just removing it from this section. So it's kind of a way to say that I'm done. I don't need to look at this anymore. Now, with the desktop, and I had mentioned that the appointments do display, what's kind of nice is when you're using the appointments calendar and you're checking in patients and you're checking them out, you'll actually be able to see that from the desktop. So this little green check mark is basically telling me that this patient was checked in and they were also checked out. Same thing here with this other patient. They were just checked in, haven't been checked out yet. So it's kind of a nice reference tool for people who may not be using, or I should say reviewing the appointments tab. Okay, so next tab on here is the appointments. Now, if you do use PracticeMate, the appointments tab is exactly the same in EHR. The only difference really is you can get into a chart because you're already in the EHR program, and you cannot create a visit the way that you can in PracticeMate. But other than that, scheduling appointments, the display, all of that is exactly the same. Now, with the appointments tab here, I have mine set to a custom daily view. So I have actually selected the information that shows up here for me. So that is an option. You will be able to customize a daily view. We do also have other views that you might want to use instead of a day view. You might want to use the weekly view. So this gives you the entire week to look at. You can see the appointment times that you still have open, the appointments that are already scheduled. The nice thing about the weekly view is you can actually move appointments without having to open and edit them. So maybe I want to move this appointment over here to Saturday. I could go ahead and just drag it and move it to 8 o'clock. Some of these appointments, maybe I want to make them longer than 30 minutes or 15 minutes. I might want to expand it. So I do have that option without having to go in and edit the appointment. Now, we do have some reports you'll be able to print. Some people like to print out a copy of their daily appointment, so you can do daily, weekly, or monthly if needed. When you schedule an appointment, you can do that from the weekly view. You can do that from a link at the top of the page, and you can even do it from the daily view. With the daily view, we also have provider staff view, so it lists the providers and staff side by side, as well as resources. Resources are basically rooms or machines that you might want to schedule your patient with. So this just gives you an idea of what another view might look like. Okay, so back onto the daily view. So when I schedule an appointment, all I really need to do is just click on a pencil here. With the weekly views or the provider staff view, all I have to do is just click on a box. So that's kind of the only difference. So when I select a time on the calendar, I'm now in the Add Appointment screen. So at this point, I can click Browse and pull up my patient list and search that way. But usually I would say the fastest way to select a patient is to start typing in their last name. So then I get a drop down and I can select my patient this way. Some people also like to search by date of birth. Maybe you have a lot of people with a common last name. So it might be easier to just search by the date of birth instead. Depending, maybe it's a new patient that you guys have calling in, they want to set up their first appointment, you actually can add a new patient from this screen. So instead of having to go over to patient's chart, add them that way, then go over to the appointments and choose a schedule, you actually can just add them from the Add Appointment screen. Just simply click the Browse button and then choose Add New. So when you choose to add new, you're going to have a patient data tab, which is basically all of their demographics, and an insurance tab. So minimum information that we're going to require at this point is first and last name. That's all that we're going to require just for you to save somebody in the program. Now, you can definitely add more information if you have them on the phone and you want to get date of birth and address information and maybe even their insurance information. You can do that. The system also will allow you to add your own required fields. So maybe you want all staff members to always put in date of birth. You want them to always put in address information. So you actually can go in and set date of birth and address as a required field. So that is an option that you can do. So once you put in the patient's first and last name, we'll go ahead and just do a little test here. And anything else that you would like to add at that point, you just scroll down and click Update. So what this will do is it pulls over that patient that I just added, so I don't have to go and select them now. Next on here is choosing the provider. So I just have to go ahead and select the provider I want to schedule this appointment with. The appointment day and time are already selected because I actually selected the 2 o'clock appointment for today on my calendar. Then the resource. The resource is the machine or the room that I might want to schedule this patient with. If you don't have resources, that's fine. You don't have to make them. If you do, you would just go ahead and choose from a list that you will be able to create. So you'll name these rooms whatever you want. Visit length and color code. You will be able to set up how long this appointment's going to be, as well as color coding. Color coding doesn't really mean anything in our system. You actually can choose what these colors are for. Some people color code by the patient, by the insurance company, by the type of appointment that it is. So it's completely up to you on how you would choose to color code. Now, the next thing on here is reason for visit. This is something that is required to be entered in order to schedule the appointment. So the reason for visit is just for you. It's only internally. Patients don't see that, but it's why your patient's coming in to see you. So you're going to be able to create a custom list for your practice needs. We do give you some defaults that may or may not apply to your practice, so you could remove them. But depending on the type of reason, you would go ahead and select, and then it could change the visit length and color code. Go ahead and grab another here so you can see. So now it went to 45 and it changes to green. So it really just depends on the reason that I have selected. You can add notes at this point if you need. You can set a repeat option, meaning maybe this patient comes in the same time every week. I can go ahead and say that they're going to do this for 6 weeks, and it will actually schedule all of those for me. And then we do have a reminder call option. This is Reminder Me. It's actually another service that we offer. It's $29.95 a month for the first 500 calls. And what that will do is it'll call a patient just to remind them of their upcoming appointment. It does also send out email reminders as well. So when we update this appointment, it's now going to add it onto the calendar. So here is our appointment that we just created. So at this point, when that patient comes in, I can go ahead and edit their demographics and enter in the rest of the information that I might have not added at this point. Now, when you're getting all of your appointments scheduled, then the next thing would be for the patient to come in and you actually check them in. So when you check them in, our system will actually timestamp that for you. So we'll go ahead and check in this patient right here. So this little gold O here, if I put my mouse over that, it will now pull up this patient's demographics, their insurance information. I can add a payment if I need to. So this will be done during the check-in process. If you need to change any demographics, you can do that here, and it will save it for their record. Insurance information also can be changed here, and it will save it to their record. Now, it does show me patient responsibility balance because I do use the PracticeMate system. If I wasn't using PracticeMate, then it really would not be showing this. I do have that option of adding a payment here as well. If I add a payment here, then it will add that into PracticeMate for me to apply later. When you do add a payment, you will have an option of generating a receipt. Now, with the receipt, you'll be able to add your practice header, and if you want, you could even upload a logo or some type of image that you would want on your receipt. You also can upload this same logo to your progress notes as well. At this point, I can go ahead and check in my patient, just simply marking that check-in box, and it will then timestamp for me. At that point, I just click Update. So now it has entered the time that I have checked in my patient. Next thing is to check them out. So as they had their appointment, they're leaving, now maybe you want to check them out. If you don't check them out, that's fine. System doesn't require you, but if you do, it gives you additional things that you could print out and give to your patient. So the check out screen will allow you to maybe give them a copy of their upcoming appointments. Maybe you want to give them a copy of patient instructions. The provider entered them onto the progress note. Maybe you want to give them a copy of their visit summary or print prescription. So you can actually check these off and choose to print them. You can see if a payment was taken during the check-in process or add that payment now. And then you can actually completely just check out the patient. So when I check this off, it will date and timestamp and tell me how long the patient was in the office. So now I have both my check-in and check-out time. So back on the desktop tab here, I had mentioned that the little green check mark indicates the patient's been checked in and checked out. So this is kind of nice if, you have a nurse in the back of the office that doesn't really use the appointments tab. They can look right on their desktop and they can see by this green check mark the patient's been checked in and is ready to be seen. So it's kind of a nice thing because then from here, all they're going to do is click on the patient's name and it takes them right into the chart so they can get started. Okay, so the next tab on here is the Patient Charts tab. So with the Patient Chart tab, it's going to be all the patients. The system actually will allow you to see 100 patients at one time. It's just a matter of changing your page numbers at the bottom here. You can filter and look for patients by a bunch of different things here. Now, when you do search for patients, to enter their chart, simply clicking on their first and last name will go into their chart. You also can use the open chart icon. If you want to just edit their demographics, you would use the Edit Demographic pencil. You also can add a new patient from here. So instead of doing it from the Appointments tab and when you're scheduling that appointment, you can just add them here. So it looks exactly the same. I'm just putting in the minimum information that we require at least, and then any additional information beyond that. You also can put in their insurance information. If you have an existing software, give me one moment here. Sorry about that. If you have an existing software that already has patients in it and you'd like to transition to our EHR, our system has the capability of importing patients, their demographics, their insurance information. So it's just a matter of having a session with one of our technicians that can assist with that, but those patients could potentially be imported. Okay, now at this point, we'll go ahead and enter a patient's chart here. Okay, so with the patient's chart, the first thing you're going to see is their summary page. So the summary page is basically a list of information from previous encounters that I have created. So I have different panels of information here. I have actually customized which panels display. So I have selected from the list what information I want displayed on my patient summary page. So I have vitals, lab orders, medications. So depending on the type of practice you are, you can go through and select from the list that we have. So you may not need vitals. Mental health, you might not want to put vitals. Chiropractor, you might not really put vitals on the progress note every time. So that might not be a panel you'll want to see. So you will have options to pick through a list. With the panels, I have mine set to a single panel view. You also have an option of doing a dual panel, which is basically these panels cut in half and I can just see more panels at one time. So that's an option. This is set up by each user, so each staff member would be able to choose how they want their summary page to be displayed, and it doesn't affect anybody else. What's nice about the panels here is this is a quick way to kind of view and go back and edit progress notes. So I can go through and I can look at my list here of all the notes, I can edit, I can view them if I need to do that. To get started with a new note, you would come up here to progress notes, choose to add a progress note encounter, and then choose from a list, whether it's the short form, the full form, user-defined, or system. Typically, I wouldn't recommend the system because it's not one that's customized. So you would want to use the user-defined because that will be one that you will be able to customize so it meets your practice needs. If you are a practice that has somebody triage patients, like a nurse, a medical assistant, they would use the nurse note here or the short form. So this only really allows them to put in certain information, allergies, medications, vitals. So this is what the nurse note would look like. So a lot of information gets pre-filled, the day, the provider. You can edit smoking here. When you add smoking at least to one encounter, it will then auto-populate to every new encounter for you automatically. You have your vital signs. So each user actually gets to customize which vitals display on their specific note. Now keep in mind, if someone's going to be editing the note, then you might want to make sure that your vitals actually match when you set up your layouts. So when you put in vitals for a patient, our system automatically calculates the BMI for you. So that is something you don't have to calculate yourself. With the allergies and current meds, there is a default that you guys can turn on to actually copy current medications and current allergies to new encounters. So it's not something that you have to sit and enter every time. The system actually would do that automatically, which is why you see some allergies and medications here already. If it's a new patient and you don't already have allergies and meds added, then you can use the allergy search button. This is basically a system list that you would be able to go through and select an allergy. You also can use the known allergies if needed. The text box here, this is notes regarding the allergy section. So this is something the provider would be able to see as soon as they go to edit the progress note. Current meds, same thing by using the drug search. This is a system list that you would be able to go through and search medications or mark currently not taking medication. At the bottom here is the nurse note. So this is any additional information that they might want provider to see regarding this specific patient. So every now and then, there could be things that you tend to say all the time. So instead of having to sit and type that same information, you can use basically a stored phrases list. So the nurse actually would come over here to this first three-dot button and select from common phrases that they have decided to save. So patient complains of heartburn, they complain of headaches. These are things that I can then have quickly pre-populated so I don't have to sit and type that every time. So the best way to add new phrases is to simply type something, highlight it, click this A button. This is going to then add it to that stored list. You also could come in here to that three-dot button that does have the list available and choose to add this way. So either way that you add, you'll be able to come to this list and actually just simply select, and it populates into the nurse note section. So there is something very similar to this for the provider, which I'll show you here in a second. So after the nurse or medical assistant or whoever is triaging the patient has entered in the information, then they're just going to click Update. So at this point, this is now going to bring you out to the progress note so you can see what it would look like. So this is basically the start of the progress note, and the provider would then go in and edit the progress note to enter in the rest of the information. So usually I would recommend that a provider comes to the summary page. So basically you just enter a patient's chart and come here to the progress note encounters panel, because that most recent progress note that the nurse would have started will be displayed at the top. All you're going to do is then come over and choose to edit. There are other ways in the program that you could then go and edit as well. So this is what it would look like if you are basically editing what the nurse would have started, or maybe you don't have anybody triaging patients, like a mental health. You're going to come in here and just start your own note. So at that point, you would come up here to progress notes, add progress note encounter, and go straight to the full form. When you choose your full form note, this is what it will look like for you. You just wouldn't see that nurse note section. So with these, you're going to choose what information is important for you to have on your progress note. So by system default, we're going to give you a lot of sections that you may or may not need. So when you go in to customize it, you'll remove the sections you don't want. You will have options of adding your own custom sections as well. So you basically would be able to name a box, whatever you want, and it will show on your progress note. Now, depending on the type of visit that you're having with the patient, if they, are coming in for something similar as the last time that they were in the office. It's a reoccurring visit, same information, and you don't really want to retype all the same information. Come over here to the left side panel. This would allow you to copy information from a previous note. So the problem list, this is going to give me all active diagnosis for the patient. So I basically could go through and I could choose to copy, and it will copy to my current encounter. Same thing with allergies and meds if you don't have the default turned on. You can also copy over history information, and it just pulls over to the progress note. If it's a majority of the progress note that's going to be the same, then just come down here to encounters. So instead of having to go, each section one at a time and click copy, you can come to a previous encounter, click the copy button. It's going to basically give you the entire progress note. So there's our diagnosis, UPTs. So it's going to basically copy everything with the exception of vitals, lab results, lab orders, parent and guardian instructions. So I could choose the information here that I want to go ahead and copy and click copy to current note. And you'll see that it now basically pulled over information to my chief complaint. It basically added to my history of present illness. So here's the second thing that I had copied. So it didn't erase what I previously had copied. So anything that you do type and then choose to copy from the left side, it will not erase. It will just add to it. Now, aside from copying, like the nurse note where you have stored phrases that you can select, to pre-fill that nurse note, you can basically do the same thing with the provider's progress note here. In this case, I would refer to them as guidelines. Guidelines are clickable words, phrases, paragraphs, sentences that you typically say on a majority of your progress notes. So things that you say all the time, you can basically have pre-populated. That's what these blue links are. You'll see these patient complains of the following symptoms. So if I was to click on that, it populates for me, and I can go through and start selecting the guidelines, and they will populate for me. You can do one word at a time, you can do a sentence, paragraph, really whatever you want to make one clickable link, you would be able to have available. Each section pretty much can have guidelines. So your history of present illness, your past history here, can all have guidelines on them. Same thing with review of system, physical exam. Pretty much just about every section can have guidelines. Now you can have more than one set. So I have a drop down here, guideline name, that gives me a list of the different types of guidelines that I have added into my program. So maybe I want to change them from what I have previously selected. It now gives me a new set of guidelines that I would be able to select. And then it just pre-populates. It adds to what I have already entered. So guidelines are great because you don't have to sit and type things that you tend to say all the time. Guidelines you're going to customize because it's how you talk on your progress notes. We do have a library that you actually can copy guidelines that we have created for other users. So you could copy and add to it, or if you prefer to just create your own, you also have that option. So as we continue through the note here, some sections are minimized just due to spacing. So review of system is minimized, just expand it. Again, each section here can have guidelines. You'll be able to pick and choose which sections here you want displayed for the review of system. The vital signs carried over from what the nurse had actually entered. So we can add to this, change it if needed. If you are a pediatric office, depending on if the patient, I should say, if they were under 20, I would have growth charts, growth percentiles displaying here for me, and I can get to growth charts from here just by clicking on this View History and Graph button. It now is pulling up a list here of all the vitals I have entered for the patient, but I could get to growth charts from here. If I don't need growth charts, but I just want to maybe graph their BMI, I could go ahead and select and choose from the list here what I want. So I could go ahead and select BMI, and it would graph for me. Next on here is the assessment and plan section. Let me go ahead and remove these really fast. With the assessment and plan section, if you are using PracticeMate for billing any information that you enter here, the diagnosis, the CPTs, could actually populate over in PracticeMate with a visit, and then you can turn it into a claim. If you use a super bill in PracticeMate, it'll automatically show up in EHR. If not, then we would encourage you to create a super bill in EHR. The reason being is instead of having to click on each button here to add a diagnosis, and same thing with the CPTs, I can click one button. So my super bill will allow me to select from a list of codes that I have saved. Now, I have a couple super bills here, that's why I have to choose from a drop-down, but you can actually set a default super bill to your specific provider or user, and then it would automatically populate here. So it'll pull up a list of codes that you have added, your charges in your practice, that you basically bill out. So you will go ahead and select from your CPTs, your diagnosis codes, and you're going to notice that it pulled over here for you automatically. Let's get rid of that one. So at this point, I have added in my diagnosis, I've added in my CPTs, so I actually can send this billing over to PracticeMate, and it will generate a visit, and then I can turn it into a claim. Next on here is the lab orders. So I can generate a lab order, radiology order, or even a referral order if I need to. So if you need to generate a lab order, what it will do is it'll pull over, grab that. It'll pull over the patient's demographics automatically. Because I'm doing this in a patient's chart, it pulled over their information. Because I also am doing this within a note and I have selected the diagnosis, it has automatically pulled that over here as well. So at this point, I only really need to put in the test codes. So with test codes, I would recommend using a lab sheet. This is very similar to a super bill, but it's all the test codes you use for this specific lab. So I can go ahead and just select my codes, close it out, and it pulled them over for me automatically. There is a section here for specimen collection. And then at this point, I can update. So it saves my lab order, and I can print it later or submit it later, or I can update and print, or I'm sorry, update and submit. So if I was to click update and submit, this would send it out electronically to my lab. So with the lab order that I created, just for those who may be doing labs through our program, is that we are interfaced with a lot of labs. Some are considered bidirectional. You can send out the order electronically and receive results electronically. Some are just a results only. So you would actually have to maybe print and fax the lab order or maybe give it to the patient, but then you'd get the results back electronically in the system. So we do provide a list of labs on our website as well as all the information you would need to set up an interface. Typically, you need to reach out to the lab first, and whatever representative that is typically your contact or who's on our list, and then they will reach out to us for you. There's a section here for prescribed meds. If you want to do e-prescribing, we are set up with a service. They're called SureScripts. That's interfaced with the program, so you would have an online e-prescribing button here instead, and it would take you to that SureScripts portal. Immunizations can be entered here, so simply clicking that immunization button. So you can specify the type of immunization that this may be. Maybe it's a new immunization or maybe it's an old one. You can enter. Our system will have required fields for you, so they will change depending on what type of record you are selecting. As you continue through the note here, again, guidelines can be set up for you. So it just pulls it over. You can have custom fields that you basically can name whatever you want. As you get towards the bottom, you will have some sections here that apply to meaningful use. So if you are a provider that's going to be using our EHR program for the meaningful use incentive, which is the Medicare-Medicaid incentive that they have, this clinical quality measures, clinical decisions, and meaningful use checklists all apply to meaningful use. We do provide separate training specifically for meaningful use instead of just the normal EHR training, so we can show you what to do in the program to make sure that you do meet meaningful use using our EHR. A couple other things at the bottom here is a health maintenance alert. So a health maintenance alert would allow you to set some type of alert for maybe the patient needs to come back for a lab order in 2 months, or maybe they need to come back for a certain type of treatment in a year. You can put a description of whatever it is, assign a due date, and then how often you want the system to remind you. So depending on how often you set it up, every time you go into that patient's chart, you'll get this alert to pop up. So we have the health maintenance that will pop up depending on the interval, and then we have basic alerts that would actually pop up every time you go into the chart. You can actually assign a new task from here. So in the desktop tab, I showed you how you guys can generate a task for a staff member. You actually can assign a task while in a progress note as well. So maybe I want somebody to send out that lab order I just created. I could go ahead and put in a subject, choose who I want to assign the task to, and update, and that person will see it on their desktop. There is a spell check, so this is a standard dictionary, just keep that in mind. And then you have an option of adding confidential information. So when you add confidential information, this is not going to show on the progress note, but it will stay in the patient's chart. So any time you have a situation where you don't want something to be on the progress note, maybe like if there's abuse at home, and you don't want that on the note, you would just add here, and it will always be in that patient's chart for you. At this point, if I click the update button, it's going to save everything and take me out into the view screen. If I apply, it's going to save everything, but keep me in here. So you'll see these buttons throughout our program. Apply is pretty much a save and continue. Update is a save and finished. So once I hit update, I can still go back and edit this note at any time. Okay, so this brings me out to the view of my progress note. So I have my header here for my patient's information. This information that it's displaying is what I filled out on the progress note. So I didn't really fill out anything under the review system or the physical exam. Therefore, that information doesn't show a bunch of empty space here. So it's only going to show what you are filling out on your progress note. At the bottom is giving me a spot where I can put in my signature. Now, the system is electronic, so we will electronically sign for you. All you have to do is click the sign off button. Now, when you do that, you can no longer edit or delete an encounter. So once you sign off, you can't delete, you cannot edit. So the system doesn't ever really prompt you to sign off. We never require you to sign off. That's completely up to you on when you choose to sign off on your progress notes. Now, in addition to the progress note, depending on the type of specialty that you are, you might have additional forms that you typically fill out, like checklists and stuff like that. So at that point, you can come and add a document to this encounter. Under the document drop-down, I would choose to add a document. Now, we typically refer to these types of documents as templates. So it's pretty much like taking a form that you normally fill out on paper and making it electronic. So the idea is to get away from that paper and to be a paperless practice. So to give you an idea of what these forms might look like, here's kind of an immunization schedule that was created. I can go ahead and fill out, or a hip regional exam. So depending on the type of form that I select, it will give me text fields that I can fill out. It gives me check-off boxes, drop-down menus. As I continue down here, more check-off boxes, text fields, and then I can update. I can go back and edit that document until I sign off on it. You never want to use a document in place of a progress note. The reason is anything that's entered on this progress note here is going to show as structured data. It's going to populate in other parts of the program for me. If I am only using a template, it's basically like scanning and uploading a document. That's all it's going to do is just keep that data on that document. Now, we provide a library for you, so you are more than welcome to go through a huge list of templates that we have and use those. Or if you actually have your own documents that you like to use and you want to keep using, then go ahead and fax or email those to us, and we will create them and put them in your account for you. And that's actually at no charge to you. So in addition to adding the document, the next thing would then be to either route this to somebody. Maybe I want them to review the note before I sign off. Or maybe I want to send the billing information over to PracticeMate, so my biller could generate a claim for me. So if I choose to create, I'm going to choose to create a PM visit. So any diagnosis and the CPT codes that I have entered now are going to show PracticeMate, shows me that a visit was created, and I would be able to generate a claim. So So at this point, you wouldn't actually have to do anything additional in EHR. You even can print. Some people like to print out a copy of the note or lab orders, or maybe a copy of their visit summary. So you would have the option to print here. Now, once I sign off, I'll go ahead and show you here. Again, once you sign off, you can no longer edit or delete. It will put in a signature down at the bottom here. So it electronically signed for me, and it did timestamp. Oh, I'm sorry, let me go back here to this one. It bumped us out of that note. So it electronically signs here. Now, in those cases where maybe you signed off and you realize I actually forgot something, I forgot a diagnosis, or maybe I need to add a little bit something more to the physical exam. So you would then be able to do an addendum. So with the addendum, I can go ahead and put allergies, meds, diagnosis, CPTs, and any additional comments. So this will now show up at the bottom of my progress note. So there's that addendum. Now the addendum, you can go ahead and continue to edit, and then you even have an option to sign off on that addendum as well. At the top here, the rest of these blue links pertain to this patient's chart. So the progress note encounters is actually what we're on right now. I can add the note. I actually can get to the patient's problem list. Some people like to kind of look at this and view all the patient's active diagnoses that they have. You also can see the procedure list as well as history. So you can kind of see all of that versus looking at it on the panel. The order, the lab order list here, I actually can generate a lab order. I don't have to just do that from the progress note level. I can actually generate a new order. And I could even maybe submit these out electronically. So if I'm set up with a lab that does do electronic transmission, I'd be able to submit them here. Or in this case, I then would just be able to print out the lab order. Results will come back electronic if you are submitting to a bidirectional lab or a results-only lab. If we are not set up with one of the labs that you typically send to, at that point you would just do manual results instead. Now the medications here, this is going to list the patient's current and prescribed meds. So we'll give you all of their active medications. Let's let you know if it was listed as a current med with a C. And then it will also show P here for prescribed meds. Under the documents, this is going to display all documents that I have maybe scanned and uploaded to my patient's record, or even templates that I might have used. So I can kind of see them here based off of the type of category that I assigned them to. I can add a template from here, so this just pulls up my template list to select from. You can even upload documents from here. So at this point, maybe you currently are a complete paperless practice and you're transitioning to electronic records. So you want to upload all of your paper charts. So what you would need to do is scan and upload those to your computer. They need to be a file on your computer, and then you can title that document, choose what type of document it is. So maybe it's old progress notes or old orders. And then at that point, just select the file on your computer. Now, as soon as you do select a file, it'll drop down another line and allow you to select another document. You can actually select multiple documents before you actually click the upload button. Now, under the others is an option to set alerts. So we have the basic alert, which will literally pop up every time somebody goes into that chart. Typically, the only time it won't show up is maybe you open the chart, exit, and then go right back in maybe just a couple seconds later. It might not pop up for you, but typically about, I think, after a minute to 30 seconds, it should pop up again for you. So that can be edited, it can be deleted. So it will show up every time you go into the chart. So you can set up the alert to say whatever you want. Maybe they owe you guys money. Maybe there's a form that needs to be filled out. Maybe you want to remind yourself to say happy birthday. Really whatever you would like. The other types of alerts that we would have would be the health maintenance. And that one I had slightly mentioned at the end of the progress note. You can add a health maintenance. If you don't do that in a note, you can actually do that here as well. Depending, you can get to the vital signs, growth charts, and graphs from here as well. So you can see all the vitals that you've entered for the patient. You can graph specific vitals and get to those growth charts again if you need to. We do have the immunization record, so for those who do capture immunizations, if you need to add immunization and it's not really on a note, you can do that here. You can even print out a list of their immunizations as well. We do allow you to actually print or download the entire patient's chart or certain notes, certain documents. So when I come to the chart download, it's going to list every encounter I have for this patient. It will list any documents that I have uploaded or a template that I filled out for my patient. So if maybe this patient's moving and they want to take their records with them, maybe you're referring to another provider and you need to send the whole chart, you can come over here and you can select all or go and choose the ones you want and then choose to print. If maybe you don't really want to print and you prefer to do this electronic, at that point you can download. So when you download, our system is going to encrypt this file, meaning it's going to zip it. It'll basically be password protected. So if I put in a password here, maybe I put something like 123, and then I confirm my password, it's now going to save this file zipped on my computer. I then can go and email it to anybody that I need to send this to. Maybe the patient. Maybe I want to email it to them. Maybe I want to send it to a colleague. So in order to be HIPAA compliant, you would need to send the document, which would be zipped, or I should say the file, which would be zipped. Send that in one email to whoever you're sending it to, and then send the password in a separate email. So basically you need to send 2 emails in order to be HIPAA compliant, one with the file, one with the password, and then whoever you're sending that to would be able to unzip the file with that password. Another thing that you can do is add confidential information here versus within the progress note itself. We do have a PHI disclosure log, so sometimes you may need to provide PHI to someone or to the patient, so at that point you can go ahead and record that you did provide that information. Here's kind of an alert that just popped up. So this gives you an idea. Every time you go to that patient's chart, that alert will pop up. You can edit or delete it if needed. And then going back to the patient list just takes you back to the complete patient chart if you need to go into another chart. Next tab on here is the Document Center tab. So the Document Center tab is going to have all encounters for my patients, all lab orders, and I can generate a new lab order, all lab results, all prescribed medications, and all uploaded documents. So instead of having to, look for encounters that I created today and go into each patient's chart to search, I can just come into Document Center, use my filter here, change the date, and it will then give me all the encounters that I did for today. So at this point, the encounter ID is a hyperlink. I could click on to view the encounter. The name takes me into the chart. I could send some of the billing information over to PracticeMate this way, simply just selecting the encounters that I want to send over to PracticeMate, come over to Select Actions and say, Create PracticeMate Visits. So at that point, it will then change the status to send to PracticeMate, and my biller could go and generate a claim for me. Now, what's also nice is that you do see the billing status, so this is a good reference tool. You can see if the document has been signed, so maybe you want to look at all unsigned progress notes. So I can change my filter here, and it's going to get rid of everything that I have signed and give me everything that I have not signed. So I could then come and sign off if I need to do that. You also can route from here. So routing sends it to somebody's desktop, whether it's a staff member, whether you're sending it to yourself, or that external contact. And then you can choose why you're routing it. Any comments that you would like that person to see, and then update. And that person will see it on their desktop to review until they decide to remove it. The References tab here will display SNOMED terms, so some practices do use these, so we provide that terminology for you. You have the Web Resources, which is kind of like having a favorites of websites that you frequent. You can actually just have that saved in EHR. And then you have a bunch of meaningful use reports. So if you are a provider that will be using EHR for meaningful use, we do provide you that specific meaningful use training, and we will cover these reports for you. The patient portal tab is a service that basically you can go in and turn on, or you can leave it turned off, but it would allow patients to request appointments, send you messages, they can get lab results, they can view some of their chart information. So we do provide specific patient ally training is what we kind of refer to it. So patient ally is basically a patient portal for your patients. And then you have Manage Office. This is one of the most important tabs in the program. This is where you're going to come and set up everything before you start using EHR. And the reason is because you want to customize the progress note, your guidelines, your templates, because you want this program to work well for you. If you don't customize, you're probably not going to find that this is very useful. So we will help you customize. We do provide you unlimited training, so we can go through everything that you need to customize specifically for your practice. Certain things you would want to customize is going to be the summary page. So this is the first thing you're going to see when you go into a patient's chart. This is what we provide for you to be able to see as part of the panels. So you can have lab results or history, allergies, that stuff you can go ahead and select to display, I should say. You also can choose if you want dual panels, so that gives you more panels, just kind of smaller view to see at one time. Next thing would be the SOAP note layout. You do want to customize this. This is your progress note. Now you have the capability of having more than one layout. So there are certain reasons why you might want to have more than one layout. There's those providers that they have their practice that they're in, usually in the clinic, but every now and then they need to go into the hospital. So you might want a specific SOAP note to reflect your hospital visits versus your clinic visits. Mental health might want one for their initial interview, and then they have one for all of their follow-up. Same thing with chiropractic. So just kind of depending on the specialty, you might want more than one SOAP note layout. Now, you're not required to have more than one. If one is all you need, that's fine. But we do allow you to have up to 10 if you ever need that many. Now, the SOAP note is user-specific. So if you have more than one provider in your account that's going to be using it, they all need to go in and customize their own SOAP notes. So when you choose to customize your progress note, we actually will select a lot of stuff for you automatically. At that point, you're going to go in and you're going to uncheck what you don't want to display. So if you don't want advanced directive or onset date to display, uncheck those boxes. If you'd like to create your own custom fields, so maybe we don't have certain sections on the note for you that you typically would want displayed, just come in here and name them. Whatever you want, check them off, and they now will actually show on your progress note. We do have some sections here that are required for meaningful use, so we do give you that red MU kind of as an indicator to let you know that those are required. Continuing through here, you have your review of system, you have your vital signs. So we do have the ounces here for those pediatric offices that do need that for the growth charts. You have your physical exam, the assessment. So as you continue through here, keep in mind pretty much every section is going to have custom fields for you. So you can name them whatever you want, and they'll be on your progress note. So when you update it, it will now change kind of the layout of your progress note so it meets what your practice needs are versus just what we provide as defaulted. So if you need to make another one, click Add New. You could copy the progress note. Maybe everything's going to be the same with the exception of like one box. Copy it and then just go in and change that one box. If you do use PracticeMate, most of your practice information will carry over. That's typically under list maintenance. The stuff that will not carry over is labs, educational resources, templates, and guidelines. So those are things you would need to go and edit. Now with the guidelines, these are those clickable words and phrases that actually you would select while in a progress note. So these are things that you say when you're writing a progress note. Now, at the end here, I'm going to give you a demo account of our EHR program. So it'll look very similar to what you see in my account, but we just provide this to anybody who wants to play with EHR before you sign up. So you guys can come in here and look at our libraries for guidelines and templates. So to look for the library for guidelines, all you would do is hit the Add New button. At that point, you're going to choose View Guideline Library. So with the guideline library, we do provide you specialties here that you can search through. So depending, maybe I want to do chiropractic, I can go through and select which one I want to look at. So depending on the guideline I want to look at, it now is going to tell me what parts of the progress note this will actually fill out. So I have some for chief complaints. This is what it would look like if I wanted to select the chief complaint. Plan notes. This is what it would look like if I maybe wanted to copy these plan notes. So you can go through and you can view the different guidelines that we have. If you'd like to copy them, all you do is select all or choose the little check boxes and then choose to select. So when you select, it pulls it over to the correct section that'll now display correctly on your progress note. You'll name them whatever you want. You can change your specialty. Now, if you don't really find some on the library, or maybe you want to add to what you selected from the library, all you'd really have to do is simply just come to the section that you'd like guidelines for. So here's my history of present illness. I could go ahead and say maybe I want to put something notes or, comments. So if I want something here to be a guideline, all I'm going to do is highlight it. Click Insert Link. Whoops. And it now puts this HTML coding around this word, and on my progress note, this would be one clickable link. I can do the same thing with comments. Highlight it, click Insert Link, and this will now be one link that I'll be able to click on. So you don't have to necessarily do one word at a time. Sometimes there's a sentence that you say, a phrase. So just type that full sentence, highlight that sentence, click Insert Link. Same thing with a paragraph. I've seen people write kind of like a big chunk of information that they say depending on the type of visit that it is. So write out your whole, paragraph, highlight the paragraph, click Insert Link. And then that will be one link that you have to click on to populate onto the progress note. So with the guidelines, this can become tedious, but I strongly encourage using guidelines because once they're all created, you're going to be able to get in and out of a note quickly, just clicking on the guideline for that specific visit, and it will pre-populate for you. You don't have to sit and type it every time. Now, the other library that we have is for templates. So also in Manage Office, down here under List Maintenance, you have templates. So these are those additional documents that you can use aside from just the progress note. So instead of having to fill out a paper form, scan, and upload it into the patient's chart, you're just going to come here and use a template instead. With our library, you're going to click on the Add New button and then choose View Template Library. So we have a lot more specialties here than we kind of did with the guidelines. So you're just going to go and find the specialty that you want, expand it, and then just click on the one that maybe you're interested in. Maybe you want to use the filters. You can type something up at the top here. So I definitely encourage going through here because you might find that a form that you use already is already in here. And then you can maybe tweak it a little bit to make it your own, but then it's already in the program. But, if you have forms that you like to use, you want to continue to use, feel free to fax or email those to us. We will create them, put them into your account, and there's no charge for that. Just send them our way. Typically, it takes maybe about 2 weeks, depending on how many templates you're sending us. But then we'll get them in your account, and then somebody will call you to show you how to use them. Okay, so it looks like we've hit the hour time frame, so I do want to open it up for some questions that you guys might have. What I'm going to do is give you guys the demo account information really fast, so you can go ahead and jot that down. Grab that. Okay, so I'm going to leave this kind of up here, but I'm also going to paste this in the little chat section that you should see on your GoToWebinar panel, just in case it's easier for you to read it that way versus the notepad. So on your GoToWebinar panel, there's a little spot that says chat. You should see this demo account information entered there. Go ahead and write it down. The username is all lowercase, OA demo. The password is the word password, followed by the number 1 with a capital P. This does not expire for any amount of time. Keep in mind that, I'm actually allowing multiple users to log into this, so you don't want to put anything real in there. Just go ahead and play with the fake patients that are in there or make your own fake patients. Same thing with the providers, but just don't put anything real into the program because other people will see it. Okay. Also, for those who might have some questions, go ahead and use the questions panel to type in any questions you guys have. I'll go over a couple that I do see here right now. Okay, so let's see here. Look at some of the questions we have. Okay, so I do have somebody asking about patients viewing psychotherapy notes, and where would you keep those notes documented and where they're kept confidential. Now, keep in mind that your patients can't come in here and view any of your information. So you're going to create a progress note like normal, just like if you were any other type of provider, by going into their chart and starting that encounter. So not unless you wanted your patient to view that information, maybe you would print it out and give them a copy of your progress note, or if you're using Patient Ally, which is something you have to decide whether or not you want to turn on and make available to patients. But other than that, I mean, a patient can never see your chart information, any of the notes that you're creating in the program. So that's something that they do not see. But if you'd like to take it one step further, if there's certain information that you want to keep confidential that maybe would never show on a progress note, at that point in their chart, you do have a confidential information section. So that's where you just enter it here, and it would never show on a note that maybe you wanted to print for a patient. You could just enter here instead. Let's see here. Another question that you have is, can the EHR program generate a correct E&M procedure code based on components and elements documented? Right now, the system will have the capability. Let me go here to edit one. We do have the option for the E&M code builder. Right now, we're actually working on a couple changes with this. Oh, I should edit my note layout. But this will pop up, and based off of the data that you have put on your progress note, it should provide you the correct procedure code. So that is something that we would then show you using a little bit more information. Nothing would show up here. One, I don't have it turned on, but the other one is because I don't have much entered on my note. Okay. Next question I see is, can I enter older records into EHR? And yes, you can. You can kind of do it two ways. One way would be just to scan and upload that patient record, their old progress notes, and it would just show as a document that you can come and view, progress notes here. Some people might take it a step further and actually come in here and create a progress note and then just go back and change the encounter date. So it depends on if you want it to be just a document that you view or if you want it to be structured data. So if you want it to be structured data, you would need to enter it in this progress note format, but just change the encounter date. But, depending on the amount of records that you have, it might just be easier to just scan and upload those documents and attach them into the patient's chart that way. Okay, another question here is, can you use a template in an encounter so we can see how we can access it? Yeah. So let me go ahead and I'm going to update this progress note. So once you fill out your progress note, you click update. Now you're on the view screen. So when you're on the view screen, if you want to add a template in this case, all you're going to do is come here to Documents. Choose to add a document. You'll have your list, so it'll be your templates that you want to use. Select. And at that point, you would just kind of fill out the information, checking off your boxes, your drop-down menus here. Just kind of depends on, what's in that form. And then update. So with this encounter, I'm going to scroll down here a little bit. So my encounter here is this one with a little red box that tells me that's the one I'm looking at. It now added this little paperclip icon. So it's telling me that I have a document attached to this encounter. So that's one thing that's kind of nice. Also, it tells me here that I have a document attached. But I can always view that document by also coming up here to Documents and choosing to view all. I can look at it that way. I also could do that within the actual encounter, which is to view the attached document. So it just shows that document or a template, I should say, that I filled out after my progress note. Another question here, is there a fast way to schedule a patient every other week? That's with the repeat option. So when you schedule an appointment, you're going to choose to repeat. Now with the repeat, keep in mind that whatever time that you have selected here, that's the time that it will schedule that same appointment, 2 weeks from now. So it's just a matter of maybe changing it to 14 days, for 2 weeks out, for 4 weeks, depends on, how many times you want to schedule it. But it will pull whatever time is here. So if the time happens to be different, it may be easier to schedule the appointments and use the repeat option and then go and edit the time later, or it might just be easier to go to that specific day. So it kind of just depends. But if the time is the same, definitely I would say using this repeat option, just put the number of days between the visits and then how many weeks you want it to schedule it for you. Okay, another question here is how to use ERX. Will that be shown on the progress note? Let me go ahead and show you kind of an idea of what it'll look like. I'll just choose the correct provider here. Okay, so this provider I have set up for the e-prescribing. So the idea would be to be able to e-prescribe within the progress note with the online e-prescription button. At this point, medications that you previously had added prior to using the new crop service, or SureScript service, will be displayed here for you. Current meds that you've prescribed or listed just as current meds will be available. So, there's a number of ways that you'll be able to search for medications. I have a doctor's list here, so it'll always pull up a certain medication with a SIG attached to it. Then I just take it to the review page. So at this point it does a drug-to-drug interaction list. I can add to the current meds and print it. I can transmit it electronically. So when I transmit, I have a list of pharmacies that I typically send to. This patient already has a pharmacy that I have sent to previously, so all I have to do is transmit. So now it's going to go out to that pharmacy. If I want to print this for my records, I can, but at this point I don't have to do anything extra. The pharmacy should receive that, and the patient will be able to pick up the prescription. Okay, another question here is, can you create a letter to send to a patient without having to create an encounter? Yes, technically you would be able to. So that's just by coming up here to Documents, choosing to add a document. So this pulls up the same template list that you can get to. So, you can have a letter kind of set up in advance and select it. And then I have it to pre-fill my patient's name and the date. So that's something we can kind of show you how to do. But you don't have to make an encounter in order to use the template. You can, if you want to, add it to an encounter, but you don't have to. You can do a template without doing the encounter. Okay, next question is, can I send consultation note to referring doctor electronically? Right now, the only way you would be able to do something like that is if the provider that you want to send to is using our EHR program. So if they're using our EHR system, you can add them into your account as a contact, and then you would be able to route certain documents to them. But if they're not using our EHR program, at that point you would need to print out the referral order and go ahead and send it maybe by fax that way. Okay, another question we have here is, can you add to the same template at each encounter, such as an OB prenatal flow chart? Technically, yes. You can go in and edit a template until that template's been signed off. So what you might do is, because if you add a template to a progress note, if you sign off on that progress note, it typically is going to sign off on the document. So instead of adding the template through the encounter, you might want to use that specific type of template by coming up to the top and adding it this way. So then that would allow you to go back and edit that specific document, regardless if you have signed off on encounters previously. But you can always go in and edit the template until you decide to sign off on the template. Okay, another question. How come the appointment span over only 15 minutes even though the appointment is for 45? Let's see here. Let's go back over here to the calendar. Let's see, I'm not too sure if you're talking about the daily view or the weekly view. The thing about the daily view is I can actually set up multiple appointments for the same time. So there are those practices that actually intentionally double book, triple book. So you would have that ability to schedule multiple appointments for the same time. And on the daily view, it just is going to list them kind of like a little row here. And it doesn't actually extend the full length of the appointment, even though I have it set up for 30 minutes. On the weekly view, it should block out the correct time depending on how long that appointment is. Now, these appointments I kind of mix all over the place. So with my appointment here, this is basically going to show a 30-minute session, and I can drag it, and then at that point, it'll now set up for an hour. So it just kind of depends on what view that you're in. On the weekly view, it'll extend the full time frame, depending on the length of that appointment. On the daily view, however, it doesn't really matter how long the appointment is. It'll always look like a little row here. Okay, so that's kind of all the questions right now. I'm going to go ahead and give you guys a couple more minutes here just in case you could think of any last questions, things I haven't covered in the program. Feel free to go ahead and type those in. Again, on the little chat box on your GoToWebinar panel, you should see the demo account login that you guys can go ahead and jot down if you haven't had a moment to do that. I'm going to pop up our contact information here for you just in case. We have our contact number and our email. So you guys can always call, email in regarding any questions that come up after the presentation today. Now, one thing I'm not too sure if I mentioned, with the EHR program, it's $29.95 a month per provider, nurse practitioner, or physician assistant. Anybody else, maybe they're an office manager, receptionist, or just nurse, not a nurse practitioner, we're not going to charge for those types of users. The only users we will look at charging is the provider, nurse practitioner, or physician assistant. If you guys have not used any of OfficeAlly's services before, you will want to talk to our enrollments team, and they'll get you everything you guys need to sign up if that's something you want to do. If you are currently an OfficeAlly user, then all you really need is an EHR agreement, which you can contact the enrollments department for, or that is also available on our website as well. Let me go ahead and pull up our lab list. I have another question here regarding labs. Oh, doesn't want to pull it up that way. Go ahead and cheat. Okay, so our interface list with all of our labs is going to be under Resource Center, Payer List, Lab Interfaces. So this is going to be our most up-to-date list of all the labs that we are currently set up with. Looks like a question regarding St. Francis Hospital or Chinese Hospital. Let's see here. I have a St. Mary's right now. Let's see about the Chinese one. Okay, I don't see either one of those labs set up right now. So at that point, if they're not on this lab list, I would recommend that you contact your lab and let them know that you would like to interface with OfficeAlly. They're your EMR vendor. A lot of times they will reach out to us, and then at that point we should be able to set up some type of interface. Depending, there are a lot of labs that I know that we are in the process with. So those could be labs that we're working on right now and still doing some testing. So I would encourage calling them and just maybe seeing if they are already trying to get connected with OfficeAlly. One thing also about this, I should say, this lab interface list, is it does tell you the contact person to get set up with an interface, which is kind of nice. How much do you charge for PracticeMate? PracticeMate is actually a completely free service. We do not charge for that at all. So you can use PracticeMate, which does all your billing and accounting at no charge, and then you're only really paying to use the EHR service. Okay, support is available 24/7. So you can call at any time. Now, the emails, typically, if you email in the evening or over the weekend, those will be we'll respond to those the following business day. But you can call. Let me pull up our contact info here again. You guys can call 24/7. Okay, another question here. Is there a way to insert basic labs into your progress note? You can add, let me go ahead and go back here to EHR. If the lab is not set up for electronic transmission or for you to get results electronically, you can still add them in here. So you can put in, you know, the Chinese lab or St. Francis lab if you need to. So it's just a matter of adding that new lab, putting in their information, and then usually when it comes to account number, I put something like 000, and then that would allow you to have that lab in the program. You can generate lab orders for them, but you'd still have to print them out and manually enter results. Okay, another question here. Isn't there a charge for PracticeMate for government insurance? Well, PracticeMate itself is completely free. Now, as far as the billing, which is typically the OfficeAlly portion, like the clearinghouse, we do charge for government claims if you have a high volume of government. And high volume typically would mean, you know, we're going to count all the claims that you send out in 1 month. If over half of them go specifically to a government insurance company, so directly to Medicare or directly to Medicaid. Some states, Blue Cross Blue Shield is also considered government. Just depends on the state, though. But then you may encounter a fee of $19.95 for that month. If you don't go over in government, you know, the majority goes to commercial, then you would not really encounter that fee. The other one that we have that is also related to the clearinghouse is printing. So depending, you know, we're set up with a large volume of insurance companies. I think the last number I heard was at least over 5,000. So, you know, that's not everybody. So there could be a time where you may need to print a claim. Now, you can print in PracticeMate at no charge. I mean, you know, you're going to use your own printer, paper, stamps, all that kind of stuff. But you also can have OfficeAlly print for you. Right now, we only charge 40 cents to do that, which, if you really think about it, that's, you know, cheaper than a stamp. Then you guys don't have to spend the time printing and stuffing envelopes and mailing them out. So you can elect to have OfficeAlly print those claims for you instead of printing them yourself. But those two fees, the government and the printing, are more related to the clearinghouse, which is tied into PracticeMate. So if you want to look at it as having a fee for PracticeMate, I guess you could, but technically PracticeMate is a free service. There's no charges for that. Okay, let's see here. It looks like that's all the questions I have at the moment. I'm going to go ahead and give you guys maybe a couple more minutes here just in case any questions, you know, if anything else comes up, I'll pull up our contact information again here for you just in case. In case those who might not be able to see the chat window for the demo account, I'm going to pop up a notepad here that also has the same information just so you can get that written down before we end today's session. For those who don't have any more questions, I do want to thank you for joining today's presentation. Hopefully I was able to answer a lot of questions that you might have had coming into today's webinar. If you do play with the demo account and questions do come up, and a lot of times they do, feel free to call or email at any time and we'll be able to cover those questions. Again, we provide unlimited training, unlimited support, no setup fees, training fees, support fees, or anything like that. Oh, looks like we did have one more question come up. Can I generate a patient plan note to the patient during checkout? Yes, you can actually put in patient instructions within the progress note and be able to print those out during the checkout process. So as long as you're putting those on the progress note themselves, then you would be able to print them out during the checkout process.